It is Health Diary. Thank you for joining us. My name is Gladys Gachanja and we're coming to you from the 4 Points by Sheraton here in Hallingham. Now, thyroid disease is a condition that affects so many people, and unfortunately, the patients and some healthcare practitioners do not even recognize it. Now, this can lead to life-altering medical conditions, but the good news is when it is arrested early, it can be treated. So today we find out more about thyroid disease, starting with this fact of the matter. The thyroid gland is a small organ shaped like a butterfly, smaller in the middle with two wide wings that extend around the side of your throat. The gland makes hormones that help control many vital functions of your body. Thyroid disease is as a result of the gland not producing the right amount of hormones. It is difficult to diagnose thyroid disease as the symptoms mimic those of many other conditions. Thyroid disease can affect anyone: men, women, infants, teenagers, and the elderly.
Well, the journey started back in 2020, December last year. That's when I was actually diagnosed of the disease. But the symptoms had started earlier way back. I could sleep up to 4, up to 10 in the morning and still wake up tired. And then palpitations. My heart was beating quite fast. And sometimes I could sit. When I'm seated down, I start behaving like someone who has come from a race, sweating, heart palpitations, and of course feeling fatigued.
Within a span of 2 weeks, he lost 10 kgs, which was a bit worrying. And when you visit the hospital, you're told you're not sick. So when he visited the doc, he explained how he was feeling. And then the doc ran all the tests in the body, and then there was the particular test for hyperthyroid. He told him, this one, all those symptoms, I'm very sure this one is going to come out positive.
I was given 2 drugs, one to control the heart rate, the heartbeat. Then I was also given now the actual dose for the hyper. And so I was taking the 2 drugs consecutively, but I was also advised to take quite a number of supplements. The weight started coming back, the bloating of stomach went, even my normal life now is like coming back to normal. But at some point I went to hypo, because now I start now experiencing symptoms for the hypo. Adding a lot of weight, and also now again feeling fatigue, feeling sick. It even actually affected even my reproductive health. For that reason, like I said, you need someone who really understands what you're going through, someone who will be able to cope with whatever changes that is happening with your life.
It needs a lot of understanding. So it's a lot of body change you can't understand. It needs someone to understand them, give them the support they need, and even in a change of diet, ensure that at least you change the diet to accommodate him.
I know there are quite a number of men who are suffering from the same, but they don't want to come out and speak about it. I think it's the right time we create the awareness and let people know there is something that is called thyroid disorder.
So let's find out what thyroid disease is, and to help us do so, Dr. Rosemary Wanjiru, consultant physician and endocrinologist, and of course through the eyes of Sarah Katule, who is the founder Thyroid Disease Awareness Kenya and also a thyroid disease survivor. Ladies, thank you for joining me on this conversation. And before we understand thyroid disease, let's first find out what the thyroid is and what the function is.
So the thyroid produces hormones, and it's also regulated from the brain, a gland called the pituitary gland. So the thyroid, the hormones are responsible for metabolism, That is the use of energy and storage of energy. Therefore, if you have thyroid disease, you might end up affecting any organ of your body. So with thyroid disease, you can have either, because of the hormone, you can either have hyper-functioning of the thyroid hormones or under-functioning of the thyroid hormones, or you can have nodules, that is a small lump or a growth inside the thyroid, where most people will present as a goiter, or it can present as a cancerous growth.
I hear these thyroiditis and Hashimoto's thyroiditis. Who are those?
In medical terms, if there's a itis, now the thyroid, and itis means inflammation. So thyroiditis means there's inflammation in the thyroid. So inflammation could be from many things. Could be viral infection, or could be an autoimmune. Where autoimmune, your body produces antibodies against itself, so it produces against the thyroid hormone and causes it to get destroyed. So if you have thyroiditis, you can either overproduce because it's inflamed, and later on as it heals with scarring, you end up having underfunctioning of the thyroid. When you specifically talk about Hashimoto's, Hashimoto's is inflammation, which is very common in females. About 30 to 40% of females will have the Hashimoto's, and you have underfunctioning of the thyroid. So Hashimoto's thyroiditis gives you hypothyroidism.
Now, you mentioned about the vital functions
Yes.
that the thyroid helps with. Apart from metabolism, is there something else?
If you're producing excess hormones, everything goes above the normal. If it's under, it goes under. So if it's the heart, either you'll have a slow heart rate or a rapid heart rate. If it's the intestines, you will get diarrhea or constipation. You get anxiety in the central nervous system. You get tremors. You get weight loss or weight gain. It affects the skin, where you have dryness of skin. You have your hair falling off, coarse hair. You have your nails being brittle. You can have swelling of the lower limbs. For fertility for females and males, you get infertility, erectile dysfunction in males, loss of libido in females. So it affects generally almost every system.
That is a long list. Okay, so we've talked about the different types and most common hyper. For you, Sarah, what was it?
Mine was Graves' hyperthyroidism, but then I detected it very late in the process. So of course I had to go for surgery. As you can see, I have a scar, but the symptoms that led to that, I didn't know that there were symptoms that had to do with thyroid disease.
And these symptoms were?
Well, for instance, the heart palpitations, like Dr. has mentioned, and then I was just shaking. And then my skin became very brittle, and then I had lots of hair loss. And then, as you can see, my eye, one of my eyes bulged out. And at the time when I was diagnosed with the disease, I was breastfeeding. So I dried up, I stopped breastfeeding, and then I lost a lot of weight. I was eating, but I was losing a lot of weight, among many other symptoms. Of course, now having anxiety, having what they call, I think, hot flashes at night when I'm going to bed, yeah, and sweating a lot also.
Okay, and did they diagnose it immediately?
So I went in and out of the doctor's office, I think 4 or 5 times before he was able to diagnose it. So I was sent to an ENT. And then when I went to an ENT, I later learned that they're actually thyroid specialists. So now I went to a thyroid specialist, and there my journey began. But that was almost 6, 7 years later.
What causes thyroid disease?
Okay, so again, we'll divide it whether it's hyper or hypofunctioning. So like for hyperfunctioning, where we have what we call hyperthyroidism, remember when I said that it is also regulated by the brain from the pituitary gland. So you could have issues in the brain that are causing it to hyperfunction, where there's a growth that is stimulating the thyroid hormone, the thyroid gland to be overproduce. Then you can have autoimmune diseases like what she had, Graves' disease. Then you could also have a nodule inside the thyroid gland that is overproducing. It could be one nodule or could be multiple nodules, which we call multinodular, or an excess of thyroid hormones, where maybe you're on replacement for underfunctioning and you're taking excess. If it's underfunctioning, again, it could be as a result of maybe surgery that has been done that you needed to remove your thyroid gland, or you underwent radiotherapy, or again autoimmune, which is now Hashimoto's.
Okay, I remember, Sarah, you mentioned that you later found out there was a family member who had thyroid disease.
Yeah, from my mom's side, but for her, she was hypo.
Is it a given if somebody has it in your family, you'll also have it?
It's not given that if someone has it, you'll have it, but genetics definitely plays a role. And also, if you live in an iodine deficient environment, that could also contribute to getting hypothyroidism.
Now, pregnancy has also been said to trigger thyroid disease. True or false?
That is true. So what happens is that when you're pregnant, you have a hormone called HCG that is produced during pregnancy, and it is similar in structure with the TSH, that is the thyroid stimulating hormone. So in the first trimester, you find that the patients are overproducing the HCG, so the TSH also tends to be overproduced. So they can present with what we call subclinical hyperthyroidism. So with that, most of the time, we usually don't treat, we observe. But if they have an overt hyperthyroidism, then we do treat.
So Stella, when they kept misdiagnosing it, what did they think it was?
There's a time I was told I have cholera, and then I was told I have malaria, I think because of the pain and
in your joint?
Yes. So yeah, it was misdiagnosed. By the time I got to know about it, literally my neck had protruded, it had swollen, and that is actually how they were able to detect. Had it not protruded to swell, I still think that I would still be
trying to figure
untreated,
it out.
yes, trying to figure it out, yeah.
Oh, wow. So
yeah.
Misdiagnosis comes with thyroid disease a lot because the symptoms mimic other conditions. So what are these specific symptoms to thyroid disease?
Okay. There's really no specific symptom to thyroid disease. You just have to have a high index of suspicion and listen to the patient. Like her case, one eye had started protruding. That is an indication of Graves' disease. Palpitation, someone could think maybe you have a heart disease, or even could be misdiagnosed as having an anxiety disorder or a depressive illness, especially if they're hypothyroid. If you're hypothyroid, you just feel flat, you have no energy, you just keep sleeping, you're adding weight, yet you're not eating much. So I think it's a high index of suspicion, listening to your patient's symptoms and investigating them.
Okay,
Yeah.
and how do you do diagnosis? Are there specific tests?
Yes, so we have thyroid function tests, which look at the thyroid hormones in the blood. If you have a swelling on the neck, then you could do a thyroid ultrasound, which would show you whether the thyroid is enlarged, and if there are nodules, that is growths inside the thyroid gland itself. There's also a radioiodine scan, which uses a radioisotope to try and see if there are nodules inside, whether they are overproducing, whether they are active. And if you find an enlarged thyroid gland, then and the hormones are normal, then you also proceed to do an FNA, that is a fine needle aspirate, so that you can try and see whether this is a benign thing or is a malignant thing, especially if you have a goiter in males. We don't like goiters in males because they have the potential of becoming malignant.
All right, now we take a short break. When we come back, they say that a woman is about 5 to 8 times more likely to be diagnosed with a thyroid condition than a man. Surely this is where you ask, tulikosea wapi? We'll be right back as Daktari tells us the science behind it. Stay with us. Thank you for staying with us. My name is Gladys Gachanja, and today the conversation is on thyroid disease. Still with us, Sarah Katule, founder Thyroid Disease Awareness Kenya and thyroid disease survivor, and of course, Dr. Rosemary Wanjiru, who is a consultant physician and endocrinologist. Ladies, this is such an informative conversation. And Daktari, before we went to break, I mentioned that just being a woman is a risk factor of suffering thyroid disease. Why?
It's not very well known why, but I think it's because of the hormones, the estrogens and the like that we carry, because women are more prone to getting autoimmune disorders. And thyroid disease, a big bulk of thyroid disease also has an autoimmune component.
Okay, so it has been said to cause menstrual disorders or even the irregularities that come with the same infertility, miscarriages? Explain.
So in the reproductive system, it has been found that it will also affect and cause the female to have the egg is not as healthy as when your thyroid hormone is good. And also for males, the same. You'll find that their semen quality is reduced, and you find that the people are more prone to getting miscarriages. And worse off, if you have hypothyroidism and you carry your baby to term and you're not on treatment, then your baby will end up with having mental retardation, because the baby cannot make thyroid hormones for about 12 to 16 weeks. And organogenesis, the formation of the organs, is in the first trimester, which is in the first 12 weeks. And for patients who have hypothyroidism or hyperthyroidism, we should still encourage them that if they want to get pregnant, it can still occur, but close monitoring, get pregnant when their hormones are stable to avoid complications. And during treatment, we need to up the medications, the dose, or change, depending on what disorder they have.
Now, I know you work with a lot of women, now that we're saying women have the biggest burden. And which is the highest issue that you deal with? Infertility?
Well, no, actually mental disorders. And of course, and infertility too, in that sometimes when patients get pregnant, they're not able to hold the pregnancy or carry the pregnancy full term. And then of course others are unable to get pregnant. And when they do, they don't know what to do. You know, and so we have always advised them to make sure that once they know that they're pregnant, to see an endocrinologist and to also work with their gynecologist. Those two doctors should be friends. But then again, that becomes costly, which is one of the issues that we are trying to sort out also, because treating thyroid disease in this country is so expensive that a normal person is not able to afford. You know, just buying medication every month, consulting with the doctor, especially the specialist, every month.
Okay, and we'll get to the treatment in a moment. Now, we said it can also affect the men. So how does it manifest in the men?
So in the men, they might have erectile dysfunction, or they have loss of libido. And again, they also get a lot of infertility. Top of what Sarah has said is that they get a lot of mental issues, a lot of depression, a lot of anxiety. So they really get affected, and they feel shy in coming out. So for any man who's listening and they're having issues, it's good to go to any doctor and find out if you have a thyroid disease.
And for the children?
Failure to thrive. They're not adding weight. They're not catching up with their milestones. They're just there. They're not, and you can't understand why they're not as the same as their peers. If they're in adolescence, they might even go into drugs, because if they have hyperthyroidism, they can tell there's something not right with them. So they're trying to cool down their nerves. So you find that some go into drugs, trying to cool, and yet they don't know. Yeah, so it's good to treat early so that you avoid complications.
Now let's talk about the stigma, and this comes from infertility, miscarriages, weight gain for the women, to erectile dysfunction, as you're talking about. What has been your experience, Sarah?
I always like to say that thyroid disease is an emotional disease just as it is a physical one. So you go through a lot of emotion, and sometimes, especially if you're in a relationship, your spouse may not be able to understand the transition. You know, you become edgy, you're moody, you don't want to work. Sometimes you don't want to work out, as you're talking about weight gain. So that misunderstanding it makes it worse for the patient, because now they get more depressed. First of all, they're not understanding themselves, right? So it's very difficult for them to explain to others what they're going through. So it becomes a challenge, the communication. And what we do actually at TDAC is to make sure that even other caregivers, the people living around the people living with thyroid disease, are also able to understand how, or the symptoms that come with thyroid disease, so that they know how to help their patients better.
Okay, and you mentioned, Dr. that there are cancers of the thyroid. So how does it move from disease to cancer?
Okay, so what happens is that you might have a nodule and it can transform. It can be benign at the beginning and can transform and become cancerous. And if the ultrasound suggests that it is rapidly growing in size and has features that could transform to malignancy, then you advise the patient on having a thyroidectomy, that is removal of the thyroid gland. And it's good to get it early because it has a very, very good prognosis. One of the cancers that if you treat early, good prognosis.
Research also says that if you are diabetic, you are at more risk of thyroid disease.
Yes.
Why?
That is more for type 1 diabetes, because type 1 diabetes is more of an autoimmune disorder where the patient is not able to make insulin.
Okay, we've touched on treatment. For you, Sarah, what was the plan?
For my treatment, actually, we sold property. My dad was able to help me get treated, but also with the surgery, I had to lean on friends and loved ones to help pay for the cost. It was very, very expensive. You know, with thyroid disease, you have to get tested every month or every other month, and then you have to consult, and then you have to buy the medication. And when you're taking the medication, you have to be so militant with it. You cannot keep fluctuating if you want to achieve what the doctors call your thyroid status, where your hormones are balanced.
So are you saying there's no support from NHIF, insurance companies?
They don't cover because, first of all, most, as Dr. said, most conditions are autoimmune. So when you go with autoimmune to any insurance companies, it becomes a pre-existing condition. You know, we are talking about hypothyroidism, like Dr. says, you have to take medication for the rest of your life. You know, so to keep boosting the hormones.
Now, Dr. you keep talking about if it's caught early, there's a solution. But now here is somebody who cannot even afford the treatment and there's no support from insurance.
I think advocacy groups talking to the government to try and be able to make the treatment cheaper and more widely available, because thyroid disease is quite common, and people don't think that it's common, but it's quite common, because there's quite a big chunk of patients who are not diagnosed.
And it has devastating effects from what we've heard today. Now, Sarah, you have a scar. That means your whole thyroid was removed?
No, my whole thyroid was not removed. I had what they call partial surgery because I also knew that I did not want to keep taking it. I take a medication for so long, and I knew that I didn't want to, again, rely on medication for the rest of my life. So I was able to work with my doctor, who was able to advise me on the different treatment options when it comes to surgery. A lot of it has to do with lifestyle, your diet, nutrients, you know, putting back in nutrients that the thyroid gland utilizes most. Yeah, and I've been good so far. Every time I go for my tests, they're always within normal range, and I thank God for that.
Dr. for those that you have to do a thyroidectomy, remove it all, how do they survive?
So they have to be on supplementation because you need the thyroid hormone. So before, maybe they were hyper, so they were taking medications to lower it. Now you give medication to increase the production. Because they are not making any hormone, so you're giving literally the hormone.
But you can live a quality life.
Yes.
Okay.
Yes.
That's
you just need the hormones to be in the optimum range. You will live a quality life.
Okay, so this has been your reality for a while, Sarah. Even as we close, your clarion call to those that wear your shoes, and of course the powers that be.
There's hope, and especially now with the organization that we are working with, as we become bigger and bigger and a network, we are hoping that we are going to be heard, and some of these, the cost of treatment will come down, and people will be able to learn how to live with the condition, because it's a long term. We say the treatment is long term. It's not something you do overnight. So we will support you. We will hold your hand until you're able to reach your thyroid status. Yeah.
Okay, and Dr. I'm sure you see so many of these, patients. What would you encourage them?
I'd encourage them that it is manageable. You might not cure the disease depending on what you present with, but it is definitely manageable and you can live a quality life. So ask for help. And it doesn't mean that you have to go only to private facilities, that even the public facilities also do have specialists who can manage and can refer in the complicated cases or serious cases.
Okay, Dr. Rosemary Wanjiru. Thank you, consultant physician and endocrinologist, and of course, Sarah Katule. You work at the Thyroid Disease Awareness Kenya. Kudos to you. And of course, being a survivor, it goes a long way to encourage others who are walking in your shoes. Time now for the health tip.
So if we talk about first aid for eyes, there are several scenarios. One is when something has entered. The commonest things is what we use in the house: jik, omo, toss. The first aid is always wash. If you can put your head in a basin of water and then just open your eyes in the water, that is perfect. Now, there are more dangerous things, and the common ones are cement and of course battery acid. Cement is very, very dangerous to your eyes, and that one you really need to wash your eyes and get to the nearest eye hospital. If it's battery acid you just wash. Wash. Actually, what we do is we get litmus paper. I don't know whether people remember that chemistry of high school. You put litmus paper in your eye and make sure it doesn't turn.
So many of your questions around thyroid disease coming through on our social media platforms. Daktari will be able to answer those questions. Thank you for joining us on this episode of Health Diary. My name is Gladys Gachanja, and we've been coming to you from the 4 Points by Sheraton here in Hurlingham. Until next time, see you. It is Health Diary. Thank you for joining us. Let's start that again. Rolling. Mbona sioni kataka red hapo? And we also have Dr. Rosemary Wanjiru. Nimekubatiza. Turudi tena, please. Hey.